Hey, this is Dr. Mark Richard, orthopedic surgeon at Duke University. I hope that everyone is safe and healthy. Today on Diamond Doc, we're going to talk about rotator cuff injuries of the shoulder. But before we talk about the rotator cuff, it is important to understand the anatomy of the shoulder. The shoulder is a ball and socket joint with the humeral head acting as the ball and the glenoid bone acting as the socket. The joint is very shallow and resembles a golf ball balancing on a tee. This design allows for an incredibly large range of motion, but this also results in an inherently unstable joint. It therefore requires the soft tissues to provide stability. So what exactly is the rotator cuff? The rotator cuff is a group of 4 muscles that stabilize the shoulder joint and coordinate its movement. These are the supraspinatus, infraspinatus, teres minor, and subscapularis. These 4 muscles and their tendons pass through the shoulder and insert on the humeral head, effectively holding the ball in the socket or on the tee. These muscles also help to abduct or elevate the shoulder, as well as externally and internally rotate the shoulder, all motions essential to throwing a baseball. As the tendons of the rotator cuff muscles pass between the acromion, or the point of the shoulder blade, and the humeral head, they can be impinged and get inflamed. This resulting tendinitis can cause pain with use of the rotator cuff muscles and will require a period of rest and rehabilitation to recover. These injuries occur due to the repetitive motion and overuse of these tendons. If the injury is severe enough, the tendons can partially or fully tear. A rotator cuff tear typically requires surgical repair in order to allow the player to return to throwing. This is most commonly performed through the arthroscope and requires a significant amount of time for rehab. One study found that in competitive pitchers, 85% of players were able to return to pitching, but only half of them returned at the same level or higher. Many players miss over a year with this injury, and in this study, no players were able to return within the same season. Knowing this, prevention of these injuries is key. Using proper technique and throwing mechanics can help to limit overload of the rotator cuff. Furthermore, maintaining appropriate strength in all of the shoulder stabilizing muscles can keep the rotator cuff healthy. And finally, listen to your body. If you experience pain in the shoulder while throwing, stop immediately and have your shoulder examined by a medical professional. Do you have other questions or comments about rotator cuff injuries in baseball players? Please respond in the comments and ask your questions using the hashtag USABmailbag.